Hello, my name is Camila Ospina. I'm from Bogota, Colombia. I'm 21 years old. And last year in 2020, I visited the doctor who gave me prescribed medicine for my acne. I was supposed to follow up checkup every 2 months the blood of my body if everything is okay with it because it's a very strong medicine. But in January, just after 11 days, I started to have a very big headache in this side of my head. And the doctor said that was normal in the first days to have headache. So for me it was normal. But was 3 days and it didn't go out. So I start feeling really bad. On the third day, I have a convulsion that it's something that I don't remember. My parents told me that I have a convulsion, I have to go to the hospital. In the hospital, I start to be really crazy, really mad in every moment. I didn't want anyone to touch me. I want to leave the hospital quickly. I didn't want to be there. I stopped talking. I was just like doing this and didn't talk anymore. And in my drama that I have really mad, I start to another convulsion in the hospital. They did a CAT scan and they found that in the left side of my brain it was full of blood. So they put me in a coma for relax and recover my brain, and this was for 2 weeks. They take me out the tube, but I opened my eyes, but I didn't respond. When I wake up, I couldn't move my body, I couldn't talk, nothing. Just open my eyes, and the doctor says to my parents that in the future I could not walk or talk again, maybe, or I'm gonna have a really long recovery. I was slowly recovering, but the doctor said that it was a miracle. I start moving, I start responding, but I have my words like a child, and my actions like a child. What's the name?
Diaper.
You have the diaper, and I was like, but I need the bathroom, but I couldn't say it. I have pee. I need to pee. Tengo que hacer chichi. Tengo chichi.
You don't want to be wearing a diaper, understandable.
Okay.
So what can you say about this video they took of you?
In that video, the nurse was giving me a candy that in Colombia it's a bonbon for me to start to swallow and start to eat with my mouth.
What about this?
Then I start to eat alone. So something that I couldn't do so good because my hand is shaking in every moment. So my hands didn't respond to me very good. So in this video I start to exercise my lungs because of the problem that I had here in the right one of
breathing. You had fluid in your lungs, right?
Yes. My mind was like a child, so I have to relearn a lot of things. Like in this video I was coloring with my dad, that he was helping me to remember how I did it in other moments in my life.
Yeah.
This video is from a month and a half
from the time
I
they brought you to the hospital.
They brought me to the hospital, and I was like the mind of a child, so I have to relearn a lot of things. I arrived to the hospital on January and I went out on March. That was the best day of my life. I was really happy when I could go back to my home with my family. The food in the hospital is not so good as in my house, so I told my dad I really want to eat pizza. So he said, okay, when I arrive to your house, you're going to eat pizza with my mom and my dad. It was like the first month and a half. Every day that my mom could visit me, I asked her, Mom, what happened to me? And my mom, Camila, you have da 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 da. Okay, Mom. 2 minutes later, Mom, what happened to me? Camila, you have la da 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 da. Okay, 2 minutes. Mommy, what happened? My mommy, very patient to tell me everything in every moment that I ask her. So that the ACV could affect any person in every age. I think that that's something that couldn't happen to me. So it was really, really a miracle for me, because there's a lot of people that can not walk or talk again in their life. So this is a recovery that doctor says at the first time that I could be for 8 months for Camila could walk again. And now it's just like 5 months and I'm already talking, laughing, walking, running, everything.
It's July and you traveled to Boston.
I tried to Boston to learn English again. Yes. So, because the experience is horrible for my family more than me, because I didn't remember. All the first time I don't remember.
And now you have a new outlook, you have a new perspective.
Completely. There are some things that are not important. For example, acne, I know it's important because my face was really, really bad.
As a young person.
Yes, a young person, just 20 years old, and really, really bad. It's something that we don't want to have. Life is more important than that.
Than your skin.
Yeah, my skin could be better, but I prefer to have acne and walk, just it's not cool. Okay, so my family, my friends, like everybody that knows me, pray a lot for my recovery. So please, that Camila don't die. It was really not just my brain, it was my lung and my kidney. Yeah, it was everything. So they were really scared that I could die, but my parents never believed that. They said, no, Camila is going to be okay. She has to be okay. So they pray a lot. My aunts, how's the aunt's boy?
Uncle.
My uncles, my cousins, the doctor that it's Juan Fernando, it's the best one in the world. For him, it's that he did a lot for me to recover. Patient people. So I'm really happy.
We're doing this.
Yes.
Yeah. Well, thank you. Personal experience that you had, Camila, and I'm grateful, and I'm sure your parents are so thankful,
Yes.
to the doctors, to God, and to you for really being strong.
It's true. Thank you, Rosana.
Thank you, Camila. Okay,
Please.
Thank you.
Yes, thank you, Rosana.
So there are quite a few articles out there that studies whether or not this medication has a direct association with cerebrovascular and thromboembolic disorders. Camila did show me one document that showed right parietal intraparenchymal hemorrhage, study arteriovenous malformation. AV malformations are abnormal connections between arteries and veins, usually in the brain. These are structural abnormalities present at birth. With increased blood flow and pressure, these AVMs can rupture, causing bleeding into the brain, much like a ruptured aneurysm. Going back to right parietal intraparenchymal hemorrhage, remembering the functions of the parietal lobe, it makes sense why Camila manifested with weakness, aphasia, and the inability to write, read, and retain new information. Thank you, Camila, for this opportunity, and thank you for sharing your story with us.